The two ends that I see that are there is one, the bio piece where you're just looking at stem cell. You're looking at it and saying that if I were to cut my median nerve over here, my median nerve would grow 1 inch a month and grow exactly to my hand of where my median nerve was innervated, and that's in my peripheral nerve. My peripheral nerve looks very, very much like my central nerve. If I were to cut my neck and I wanted to grow 1 inch, there's a good chance I could never cut it. Or if I cut my brain, it could never do that little growth in there. So there's something different between the fertilizer that we have in the peripheral nervous system or the genetic makeup to say grow over here in an arm, but not grow over here in a brain or a spine. That is seemingly an easy project, certainly a Nobel Prize, but seemingly an easy project to figure out when these look alike, what in fact is different about them. I think that it's just a matter of breaking through and figuring out what is that we can do to gap the injuries, because the injuries that are spinal cord injuries, they're not all that impressive. I mean, few are ever severed, few are problematic. You know, if it were a bone, it would be a piece of cake. If it were muscle, it would be a piece of cake. It's only a real problem because it happens to be a central nerve. You know, if it were any other part of the body, it would be no problem. You do worse to your knee when you scrape your knee every time you're falling. Every time you're getting a black and blue, it's just very sensitive tissue, and it's a matter of making sure that that sensitive tissue can regenerate. So that's hope number one in my mind. Hope number two is the opposite end of just looking at the robotics. Looking at the exoskeletons, looking at the Lokomats, looking at the fine technology that you're looking and saying, why is it that I can't walk or run or be the $6 million man? Well, absolutely I can. It's just a matter of getting the technology out there, and you should be able to put the microprocessors in my knee, in my hip, in my ankle to reproduce me to be able to run 60 miles an hour after a spinal cord injury. There's no reason why you can't do that. So that's my two hopes, and I expect fully to see them in my lifetime.